Perfect. Okay, then. Good morning, good afternoon, and good evening to the members of the network, our Pasteur Network community, and welcome to this very last Pasteur Network monthly seminar 2025. As usual, we'll begin with our speaker presentation, and we'll follow it by a Q&A session. You are welcome to drop your questions in the chat at any time, or ask them directly during the Q&A. And please remember to keep your microphone and camera off during the talks to ensure a smooth experience for everyone. The session is recorded and it will be on our YouTube channel very soon. So you can share it with your colleagues or any partner that could be interested. Today, I'm really happy to take you to Vientiane in Laos for a seminar titled Institut Pasteur du Laos, the story of a young institute in Asia. And for that, we are very pleased to welcome our speaker, Professor Philippe Buchy, General Director of the Institut Pasteur du Laos. Philippe is a clinical microbiologist and virologist. Since 1995, he had been working on various viral diseases in Madagascar, New Caledonia, Vietnam, and Cambodia. He headed several national and WHO reference centers on influenza, rabies, and arboviruses within the Pasteur network. In 2023, Philippe joined the Institut Pasteur du Laos as General Director. He's also author of 200 articles in peer-reviewed journals and several book chapters and WHO guidelines. I will give you the floor, Philippe, in 1 minute, but before that, I would like again and again talk about our platform. You may know that we have now a platform called PNLink for the whole Pasteur network. And this platform is completely for free for everyone in the network. You can register on going on community.pasteurnetwork.org if you're not. And I want to thank Philippe, who is actually a member of the platform, and he's on the group A on the Asia Pacific group. As you can see here, we are creating groups based on regions, on activities, etc., on initiatives in the network. So of course, it is your platform completely for free and for everyone, not only researchers, students, postdocs, everyone is concerned. Okay, so I will stop sharing my screen now and give you the floor, Philippe, for a presentation, and thank you again for being with us.
Thank you very much, Hichem, for your kind introduction. Good morning, good evening, friends, colleagues, wherever you stay in the world. Very, very pleased to be here and present the story of the Institut Pasteur du Laos. Is my presentation showing correctly?
Yes, it's perfect.
Perfect. Thank you very much. So this is now the picture showing you how the Pasteur Institut du Laos looks like at the current stage. As you can see, it's not a huge building, but it's a beautiful building that was now established 13 years ago, thanks to the amazing efforts from my predecessor Paul Bray and by Antoine Desgraviers, our colleague from Guadeloupe, who did an amazing work building all this. So first, an introduction. The Pasteur Network, we all know, is a network of 32 members in 25 countries, but in the region, we are 9 institutes, including Iran, South Korea, New Caledonia, Hong Kong, the 3 Pasteur Institutes or affiliated Pasteur Institute from Vietnam with Dinh, Institut Pasteur Nha Trang and Ho Chi Minh City, Institut Pasteur in Cambodia, and Institut Pasteur du Laos. So for those who have never had the chance to come to Laos, Laos is a country that is surrounded by Vietnam on the east, by China in the north, by Myanmar on the east, on the west, and Thailand in the south, and Cambodia also in the south. It's a small country in terms of population also, with only 8 million people and 1 million people in the capital called Vientiane. So why do we have a Pasteur Institute in Laos? I think the story all started with this person, Dr. Podmek Dalaloi, who was Minister of Health at that time. This picture that was taken a couple of weeks ago in our meeting room, and you see that Dr. Podmek is sitting next to his statue here. That was prepared by, that was built by Dr. Paul Bray and Dr. Antoine Desgraviers in memory of his work. So the story started back in 2003 with the emergence of SARS. And Dr. Podmek Dalaloi, who was the Minister of Health at that time, realized that Laos was ill prepared to face any of this kind of challenge. So he went to Europe, he knocked at the doors of Pasteur Institute, of the Fondation Mérieux as well, and everywhere to try to have them coming to Laos and help building also an institute, because he saw that in Vietnam there were already 3 Pasteur Institutes, that there was one in Cambodia, and he thought, okay, why not in Laos? This was a pretty good idea, I must say. And after a lot of efforts, and again, I want to really give give a lot of thanks to Paul Bray and Antoine Desgraviers, who were able to bring that together. It was a huge effort, but this institute was created by then in 2007 by Prime Minister decree and opened in 2012. So this institute is the result of a long-term and joint decision between the Lao Ministry of Health and the Institut Pasteur in Paris. As you see, it was signed in 2006 here by Alice Dautry, who was at that time the General Director of Pasteur Paris. The Institut Pasteur initially committed to stay for 16 years before retroceding the full management to Lao government. But in 2019, the board of directors requested an extension of this cooperation between Institut Pasteur in Paris and Ministry of Health in Laos, and the management agreed to remain as such until now 2036. Our institute benefits from a very large degree of autonomy in terms of legal autonomy, scientific autonomy, management, and financial autonomy. And as such, this can be considered as a quite unique model for Lao public institution. This allows us to really run the institute smoothly without depending directly from the administration of the Ministry of Health. Many of you staying in different countries of the world understand that sometimes being directly under the management of a ministry can become a very can lead to very delay actions and administrative difficulties. So this is not something that we see. But being financially independent comes also with some responsibilities, because the Ministry of Health only covers the cost of energies for our institute and allows us to have tax exemptions, while Pasteur Institute in Paris provide the salary of the director, myself, and of our chief financial officer, Mr. Pascal Masnavet. So behind that, everything has to be covered by the resources of the institute. Without having a clinical microbiology lab and without a vaccination center, of course, everything relies then on the overheads that we can get from the research projects. And again, I can only congratulate what Paul Bray and Antoine Desgraviers have done over 15 years to make that possible. It was really, really hard, you can believe me. This is the organization chart with this executive board that is shared by the minister, with two members from the Ministry of Health, nominated by the Ministry of Health, and 2 members nominated by the Institut Pasteur in Paris. Last year, it was Dr. Marc Jouan, our colleague from New Caledonia, and Professor Yves Buisson. Professor Yves Buisson, unfortunately, passed away 2 weeks ago and will be replaced, and Mr. Marc Jouan will be replaced by Odette Tomescu, the head of the Department of International Affairs at Institut Pasteur in Paris. We do have also a scientific advisory board that meets every 2 years to help the director to build his scientific strategy. The mandates that were given to the Institute is the research and the diagnostics on emerging infectious diseases and vector-borne diseases, training, education, and capacity building. This is extremely important. In the country, we do only have a medical school. We don't have specialists trained in the country. And in terms of science, there is only a university of science that brings people only to the bachelor degree. There is no master degree program, except one program, master program in public health, that doesn't really train people to be able to work in the lab. So we really have to put a lot of efforts in training in order to build this capacity for the future scientists of Laos. And the last mandate is the investigation of epidemics. This was very well illustrated, for instance, during the last pandemic, where the Pasteur Institute was at the forefront of the epidemics, being one of the few labs able to test all the specimens suspect of COVID. The Institute has, at the moment, 2 main buildings. The building A, that we call the building A, on the top of the screen, that has 2 floors of 800 square meters each, and a building B that hosts the storage, the biobanks, a workshop, and archives. But thanks to the generosity of the government of Luxembourg, we are now able to extend our building by another 770 square meters of labs and office space, and we hope to open this new lab, this extension in the coming month, hopefully by May 2026. At the moment, there are almost 70 people working in the Institute. This Institute was built for 60 people, hence the necessity now to extend it a little bit, and also to allow the Institute to grow, to develop in areas that are now very important to be able to participate to international consortia, such as the bioinformatics, the epidemiology, the clinical research, the immunology, etc. So this extension will allow us now to grow to a next phase. Attached to our institute is the Fondation Institut Pasteur du Laos, that is hosted by the Fondation de France, and that is chaired by Madame Michelle Bocuse. Many of the oldest among you may remember her, as she was in charge of the international affairs 20 years ago. This foundation is providing some funding to fund the Young Researcher Grant Challenge. So now we had the 3rd iteration of this Young Research Grant Challenge, and that allows young researchers from our institute to execute a project that they have drafted by themselves, alone, without the help of anyone, that they have to execute, and that needs to lead for publication. Now that I already explained a little bit how this institute was built, how it operates in the country, I would like now to explain you not without going into too much details, how the different labs operate. And I will start with the virology lab that hosts actually 2 groups. The first group is the pathogen discovery group. And this pathogen discovery group is mainly funded by the government of Canada. and has a strong scientific relation with the National Microbiology Laboratory of Canada in Winnipeg. That is a BSL-4 laboratory that helps at developing programs in Laos, mostly oriented towards a reduction of the biological threat, but that allows us also to establish a biosafety office and to catalog and inventory animals and known viruses, and also to discover new viruses. And I will give you just a few examples of those. So since this project started 3 years ago, we have now collected in different sites of Laos almost 15,000 samples from bats, rodents, some from the wild, other from markets, because in Laos, like in many countries in the world, in Asia, in Africa, people consume bushmeat, and so markets also as a source of where you can find wild animals. And once these samples are back in the labs, we test them for different families of viruses of interest: the coronavirus, the paramyxoviruses, hantavirus, and flaviviruses. In NML, they test them for more pathogenic viruses such as the flabovirus, norovirus, arenaviruses, and filoviruses. At the moment, the PCR screening is done partly in Canada, but this is supposed to be transferred step by step in Laos, and they will now focus more on the isolation part of these BSL-4 agents in their laboratories. As you can see on these slides, shows you a couple of viruses that have already been detected. Just to give you examples, coronaviruses, we found a lot of diversity and a lot of alpha and beta coronaviruses, a couple of delta coronaviruses as well in bats. This is not something that is surprising, but now currently we are in the stage of further characterizing these viruses. This is not the first time we have been working on those viruses. In the past, at the beginning of the pandemic, there was a strong research project also with IP Paris, with the laboratory of Marc Eloi, and with Sarah Teman, who was very instrumental in working on those coronaviruses, and with the discovery, for instance, of a virus called banal virus in a cave not far from Vientiane, where a very closely related virus from the SARS-CoV-2 was discovered. Paramyxoviruses, we have got several hits, in particular in viruses belonging to the group of Geelong viruses. We have found several hantaviruses in those bats. There's a new one that we have recently discovered, which is close to a virus that has been until now only detected in one bat in the Philippines, that we have now found also in fruit bats in Laos. But I can give you a lot of examples of these new viruses, but what is lacking is to make the link between viruses that we found in the bats or in rodents and diseases in human or in domestic animals. For this purpose, we have developed a research project called PIMS, where we develop more platform about molecular biological platform using RPL, LAMP, etc., and a serological platform that is based on the LIPS technology that allows us then, once we have detected a new virus, to develop tools and to screen then human population and domestic animal population to verify whether this virus causes human diseases or animal diseases or not. And again, we have received quite a lot of support from our colleague from Pasteur Paris, for instance, with Sarah, from the bioinformatics platform of Pasteur Institute in Paris, from the team of Dr. Max Bonani, who has helped to to design the antigen for our lips based on the new sequences that we have identified in wild animals. The medical virology group within this virology unit is working on arbovirus surveillance. So we have now started this surveillance over 10 years ago, 12 years ago, looking essentially at dengue viruses, Zika, and chikungunya. We have implemented the SARS-CoV-2 variant surveillance since the COVID, where now we are the last lab that still maintains this surveillance of the variants. We have started recently the surveillance of avian influenza, and because the human surveillance is very weak in the country, in contrast to what exists already in Cambodia or in Vietnam, we decided to do that in live bird markets, which gives a good overview of what is circulating in the country. And indeed, after the selection of different sites in the north, central, and south of the country, we found on average 1/3 of the samples that test positive for avian influenza, mostly H5, quite a lot also of H9 and other that currently still unsubtypes, but that we are culturing and testing further to clearly identify. But what we know is that many of these strains now that are very closely related to the strains that are circulating in Laos do harbor key mutation, for instance, the E677K that we found in PB2 gene of this avian influenza virus, and that is associated with an increased pathogenicity of the virus in mammals, including in animals, and probably. So the reason why we do not find that in humans is because the very weak human surveillance system of acute lower respiratory tract infections that exists currently in Laos, and that we try to improve in the future. Since almost 50% of our dengue suspect cases are actually confirmed by a virological test as dengue cases, we have had a lot of interest at looking at those negative samples and to better characterize what we can call undifferentiated febrile syndromes, starting first with the usual suspect in our part of the world, which are the rickettsia, with the top of the list, Orientia tsutugamushi, but also Rickettsia typhi, Rickettsia felis. And you can see on the table that on average, we found 3% of samples that are positive. It's important because rickettsia diseases can be easily treated by antibiotics if you identify them, but you have to give a specific antibiotic, such as the tetracyclines, and you have to give them for a sufficient amount of time in order to clear the infection. Otherwise, it can lead to chronic infection and sometimes to death. We are starting with our colleagues in the region, especially from colleagues from Cambodia, from Vietnam and the Philippines, a project called ECOMOR, which aims at develop and validating novel molecular and serological assays against targeted priority pathogens in the region. So this is a regional common project. What we do have in common is mostly looking at arboviral infection, a little bit of rickettsial diseases, and then it's more à la carte, where people will develop a surveillance based on the national priorities. We are also looking at, in this project, we are looking at, we have a small entomological project also that is quite interesting that we share across the different sites. And of course, now it's very popular to better understand how some climatic factors may impact on the risk for emergence of infectious diseases. This project just started a couple of days ago, so maybe in a couple of years in a few years from now, I will update you about the result of this very interesting project. Next lab is the vaccine-preventable disease laboratory that is funded by the government of Luxembourg, and is a collaboration with the Luxembourg Institute of Health. And in this lab, we are currently conducting a couple of projects in relation with vaccine-preventable diseases, such as the hepatitis B, and especially occult hepatitis B in blood donors. You see on the map that over the years, the prevalence has not really been reduced. Maybe even in the contrary has increased a little bit, especially in the northern part of the country, where you have almost 20% of the blood donors that test positive for hepatitis B. We are looking also at the etiology of acute hepatitis or jaundice among hospitalized patients. We look at hepatitis A, hepatitis B, hepatitis C, hepatitis E, but also at some more regional pathologies such as Opistorchis viverini, which is a parasitic disease that leads that can lead at the end to cancer of the gallbladder. We look at immunity against vaccine-preventable disease in mothers and neonates. This is currently very important, and I know that Laos is not in a unique situation here, but since the pandemic, the vaccination coverage has dropped dramatically. Currently, the vaccine coverage rate for measles is only 25%, and you can anticipate, of course, that we do have now a lot of measles cases, and even including regular death in children in Laos. But we also recently had polio-derived cases, and pertussis is probably just around the corner. So this study aims at monitoring a little bit all these diseases. And finally, we have a project that aims at looking at the reason for hospitalization in children below 5 years of age. Here I'm sharing just with you preliminary data showing the repartition of the etiology for hospitalization. As expected, of course, in young children, we have a lot of gastrointestinal diseases and respiratory diseases, but we haven't yet started to test the precise etiology among these big groups of diseases. We look at the relationship between water, sanitation, and hygiene level in infectious diseases, especially in Cam 1 province. You can anticipate that the lack of latrines, the lack of tap water, of course, causes a lot of these diseases. This is the topic of research from one of our junior scientists who will present soon her PhD on that topic. Next lab is our parasitology lab. This parasitology lab is funded mostly by Luxembourg and is headed by a parasitologist from the nationals for NCGM, the National Center for Global Medicine and Global Medicine, right, in Japan, in Tokyo, Japan, funded by JICA and by AMED. And this project is called SATREPS and aims at eliminating malaria, especially Plasmodium falciparum, of course, and schistosomiasis as well as opistorchiasis. Opistorchiasis is this disease that I just mentioned that causes hepatic diseases. So in terms of malaria now, the prevalence of Plasmodium falciparum has considerably decreased in the country, which is a great thing. Nevertheless, the problem that remains are the asymptomatic carriers who remain a reservoir for this disease. So the next step now, the current step, is to implement LAMP technologies in the areas where malaria is present in order to detect these asymptomatic carriers of Plasmodium falciparum and to be able to treat them so that this last reservoir disappears, so we can declare the country as Plasmodium falciparum free. Then the work on Opisthorchis viverrini and Schistosoma mekongi is mostly at reducing the transmission that in the provinces where these two diseases are still circulating, and we now, because detecting these diseases in human is quite complex, we look more at the environmental transmission by looking at the intermediate host and in the water where we and the environment in general, especially the mud, to detect traces of these parasites and traces of the intermediate host. To further reinforce this work, we have just started a project with the Luxembourg Institute of Science and Technology that is highly specialized in environmental sampling and water surveillance. And as a matter of fact, we just finished a couple of minutes before I joined this meeting, the first meeting with them. They just arrived in Laos to start this project. Very interesting project to detect the DNA of these parasites and on their host in the environment in Laos, and to come with a risk map to know where we need to really focus on efforts for the elimination of these diseases through drug mass administration. We have also just kick-started another project called that is a FEF. It's funded by the French Ministry of Foreign Affairs, where we are going to collaborate with our friends and colleagues from Madagascar, mostly on schistosomiasis. Here we do have Schistosoma mekongi, but in Madagascar we are facing two schistosomiasis, hematobium and Schistosoma mansoni, and we are going to work with them and transfer the technology and the knowledge that we will acquire, especially in terms of environmental sampling and environmental analysis, to help them to develop that in Madagascar. Next lab that I would like to quickly mention is the lab called Infectiology and Public Health. This is the new lab that started recently, mostly looking at tuberculosis in Laos. Unfortunately, I will not go into much more detail because we are still working for funding. Unfortunately, the funders that we approach are the funders that have been recently highly impacted by economic cuts made by the French government. So we are still unsure that if this project will ever be funded. The last laboratory is the Medical Entomology Laboratory, headed by Dr. Kamsing Mongpalot, who was the student of my predecessor and who is now the first Lao head of lab. And we are very proud of him. He's an amazing guy who is working on ticks, on sandflies, and on mosquitoes. So they are doing an amazing job at the same time on entomology, and they are doing morphology, molecular entomology, and also doing pathogen discovery. So this is an example of the work they have done on ticks over the last couple of years, detecting new species of ticks in the country, describing on the morphological aspect, but also developing very interesting keys for the identification of these ticks, which was not very well developed in the region, to say the least. But they're also working on the pathogen discovery aspects using next generation sequencing. And they, for instance, in ticks, they have found a lot of Ehrlichia, Anaplasma, Rickettsia, as you can see on these phylogenetic trees. Now, we still have to further characterize this bacteria, but we know that some of them are associated with diseases, as I mentioned earlier, with the etiology of undifferentiated fevers, but others, they have not yet been described, and we are not sure whether they cause disease in human. Hence, the importance of having this platform, PIMS, that develops new molecular and serological methods to answer these important questions. In ticks, they have detected also some interesting viruses. Some are flaviviruses, such as the Jingmen viruses. They have worked on mosquito and sandflies. You see, over the time, they have detected in the various provinces quite a lot, catched a lot of mosquitoes and sandflies. In mosquitoes, they have detected Tembusu virus, which is a virus that causes disease in ducks. But recently, a paper from Thailand have demonstrated that Tembusu is also responsible for mortality in dolphins. So that has quite some interest, and we now want to look whether this Tembusu can also be found in other animals or even in humans. Sandflies is a really black box. Until recently, Asia was considered as free from flaviviruses. Of course, not free from sandflies. Those who have been on some beaches in Thailand, Cambodia know that there are a lot of sandflies. But what we did not know until recently, until the work done by Dr. Kamsing and his team, is that these phlebotomes, these sandflies actually are carrying flaviviruses. Flaviviruses are well known in the south of Europe with Toscana virus, with Naples viruses that diseases in human, fever, but also sometimes meningoencephalitis. What we do not know yet is whether they cause disease in humans. So we have started now very recently a fever surveillance in villages around the sites where these viruses were discovered to see whether these viruses are causing diseases in humans. So if I go quickly through our strategic plan for the next 5 years, we can see that these strategic plans are articulated around 3 main topics. The first is vector-borne diseases that involves virology lab, entomology lab, parasitology, and infectiology and public health. Focusing around arboviruses and rickettsia for the virology, on identification of viral vectors and studies vector control method for entomology lab, on the malaria surveillance for parasitology lab, at least until we have a full eradication of Plasmodium falciparum. Vivax in malaria will still be circulating, but it's not of huge public health importance. The second big axis is around metagenomic and pathogen discovery. I mentioned all the work that is done by virology lab in bats and rodents, but also by entomology lab in the ticks and in the sandflies. But parasitology lab has interest in studying parasites microbiome, while the infectiology public health lab will investigate zoonotic diseases epidemiology, and the vaccine-preventable lab will start next year to start a mother-child cohort in order to understand the complex interplay between the microbiome of these kids, the malnutrition, which is unfortunately still very prevalent in Laos, and we estimate that 20% of the children in Laos suffer from malnutrition, and the response to the vaccination. We believe that having unbalanced microbiota and malnourishment will probably explain part of the lower response to vaccination that we do observe in Laos. Now, the last topic is the vaccinology and the clinical research activities. In the vaccine-preventable lab is the project that I mentioned, the interplay between microbiota, malnutrition, and vaccination. For virology, we'll focus on the development of new diagnostics, vaccines, and therapeutics for priority pathogen. This is more at the medium long term. And for the parasitology will be to study the impact of parasitic infections on vaccine efficacy. We see quite high level of parasitic infection, especially with nematodes in the children here. And we know that this very high burden of infection really kind of hijacks the immune response towards these parasitic diseases. And so that may partially explain why the response to the childhood vaccination is not optimal. With that, I would like to thank you all for your attention. And this is some of the people working in our institute. And in Lao language, we say kop chai to say thank you.
Thank you very much, Philippe, for a presentation, very comprehensive presentation and strategical presentation, actually. So thank you so much. Yeah, so we opened the Q&A session. So I'm asking now the audience if you have any question. Yeah, Kelly.
Hi, can you hear me?
Yes, hello.
Hi, thanks for that presentation. I'm Kelly, I'm from IP Paris. I have two questions, actually. One is quick, though. So I guess I'll ask the quick question first. So you mentioned you have collaborations with a lab in Canada who has a biosafety level 3. Are there any closer BSL-4 labs in the region that you can maybe collaborate with, say, in the event of an emergency? And are you kind of exploring those? So I'll let you answer before I ask the second one.
Yes, so currently we do have a BSL-3 laboratory. We are going to have soon 2 BSL-2 laboratory for virology, but indeed, when it comes to BSL-4 agents, we don't have the capacity to grow them, to manipulate them in our laboratory. What we do is to process all our samples in BSL-3 and then we test by PCR. The reason why we work with the BSL-4 laboratory in Canada is also because the government of Canada is funding this project that allows us to implement this surveillance at the national level. But that goes even further because Canada Global Affairs also is a key player in all the region, all ASEAN region when it comes to biological threat reduction. They are supporting almost all ASEAN countries at different levels. I think we are the only one that they support at the lab levels, but they do a lot of support in the region for the more traditional epidemiological surveillance, for the reporting, and etc. So that's the reason, the historical reason. In the region, we do not have that many BSL-4. The closest one is probably the one from Wuhan in China. But that will bring us to more geopolitical consideration that I don't want to further discuss in public here.
Yeah, fair enough. No, I didn't realize that, and also it's just because Canada's on the other side of the world, so I was wondering. But okay. Anyway, my next question, that was a longer answer than I was expecting, but you kind of mentioned it throughout, but maybe could you discuss a little bit more the biggest challenges that are facing your growing institution and how maybe the Pasteur Network could help address them, possibly?
So, well, the biggest issue is probably how will I say, the funding, the economical system that is quite unique. Again, this was the fact that the institute does not have a strong core funding beside, of course, here we have the support of the Ministry that you know in Paris that is shared across several institutes of the Pasteur network. This plus the support in terms of from the French government with the international experts. We have 2 virologists that are paid. This represents more or less 10% of our global budget. The 90% of our budget has to come from overheads. So when we tell to our donors that our system requires 42% of overheads to function, they of course look at us with very big eyes and say, well, are you crazy? It's no way we are going to provide you 42% of overheads. But that is unfortunately the reality. This is our economical model, because at the end we have to pay out of 70 people, we have to pay the salary of 65 people every month. So that is kind of weakness of the economical model of our institutes. That's the reason why Antoine Desgraviers, who is, I think I saw that he joined this call, can probably explain more in detail why what they had to do. But the only solution that they could find is to build this joint laboratory with either Luxembourg or either Canada or either Japan in order to operate this lab, because this was the only way where you can get enough overheads in order to operate the institute. Because at the end, when we have to, everyone in this call who has a BSL-3 knows how much it costs to maintain a BSL-3 laboratory. But same applies for the maintenance, the daily maintenance, for the IT, for etc. That has to be funded by overheads. I would say that's probably the biggest limitation. But I mean, unfortunately, I think that many other countries in the world who were not in this situation in the past may be in the same situation as IP Laos in the future, with the funding from the US, from France and other countries now shrinking, and we will maybe be more and more in this situation in the future.
Okay, thanks.
Thank you, Kelly. I think the next one is Jean-Christophe Barral.
Hello, everybody. Thank you very much, Philippe, for this nice presentation. And my apologies if the subject of my question, you may have addressed it in the beginning, but I unfortunately missed the beginning of your presentation. It's about malaria in Laos. I just wanted to have info regarding the evolution of the incidence of malaria in Laos and the pattern of resistance, since we know it's Southeast Asia is an area of very, very intense diversity of resistance to antimalarials, particularly artemisinin, for instance. And I had eventually, if time, a third question relative to malaria.
Right. Okay. So fortunately for Laos, we are not in the same situation that Cambodia used to be, or that the border of Thailand and Myanmar, where Dr. Nosten is working, are facing, where they have really, really high level. So artemisinin is still working in falciparum here. That explains that also why the drug mass administration was still working quite well, and we are close to the elimination in Laos thanks to that, except I don't know if you already joined when I mentioned that, except the fact that now we still see some asymptomatic malaria carriers that we now want to identify further in order to treat them, so that we eliminate this last bunch of reservoir of malaria. So now I must say that there are probably only a bunch of cases, maybe 10, 20 cases per year that are reported. So it's very, very, very low now, thanks to all the efforts. So I'm quite optimistic that by 2030, we will reach the goal of complete malaria elimination here. And the profile of resistance, again, is not as bad as it's in Cambodia at the border of Thailand. And again in Thailand with the border of Myanmar.
Okay, so good news from Laos. And very quick last question: what is the ACT, first line ACT, that is recommended by the Ministry of Health in Laos, if you remember?
It's give me the name. I will tell you.
Artemisinin derivatives with mifloquine or piperacin, lumefantrine.
No, I think it's artemisinin with, but I'm not totally sure.
Okay.
For that, I need to ask our head of parasitology, because we are not directly involved in that aspect of the malaria elimination, because it's not directly under us. We do more this implementation of the elimination of the asymptomatic carriers that is directly under us. But I can come back with this answer directly to you. I prefer not to say something that is.
Thank you very much. Very nice presentation.
It's part, but whether there is also an additional one, I'm not sure.
Okay. Thank you very much.
Thank you, Jean-Christophe. Marco Vignucci, I think you're the next one.
Hello, Philippe. Nice to see you. And hello, everybody. I'm Marco Vignuzzi from Infectious Disease Labs at A-STAR in Singapore. Philippe, you mentioned that there are currently no PhD programs in the country, and I wanted to know how currently you're addressing this and what you hope you can develop in the next years, or what your hopes are in fixing this matter, if possible.
Yeah, well. Yeah, it's really it's really a very important question. Thank you for raising that. I was a little bit too fast probably on that. So, as I mentioned, there is an institute here that provides a training on a Master of Public Health. As I mentioned. Nevertheless, it doesn't cover basic science. It's more field epidemiology and tropical diseases. So it's a good program for public health, but it doesn't equip the students to be able to work in a lab. Hence, having people following a PhD program in virology, parasitology, immunology is extremely challenging. So we have been very fortunate that very recently the University of Montpellier decided to start an online master degree in microbiology and immunology, and that is online with the help of Maidol University and Gajah Mada in Indonesia, and that allows now our junior scientists to follow this 2 years master online, being still based in Laos, doing their daily job, and being able now to have a master. So now we have a couple of them doing that. In the past, they were usually going directly to Japan for PhD courses. And I have to thank Japan for the support they've provided over the years, but partially because the students that were sent there did not have enough background, I didn't find this program totally successful. For some people, it has been amazing. For others, it did not bring enough capacity for people to become really independent researchers. So we have tried to see whether we could have joint program. So the program with Hungary, that is very popular in Laos, actually, we have heard from them over the last couple of years, was focusing only in a PhD program, but without helping for the master degree. So they were only partially helping for that. And their PhD program is also not fully well adapted to IPL situation, because we do have people with HDR. So many of you don't know what HDR is, a very French program, but at least we have the capacity to train people in the HDR program in the country. So what we do not want is to have people who live for 4 or 5 years, go on the other part of the world, being totally disconnected from their work, being totally disconnected with their family, and then eventually never come back. So that's not something that we can afford, because we have so little resources. So what we want to do is to have more kind of joint PhD program where people can be based mostly in Laos, with some collaboration with universities like ESTAR, for instance. That could be a good, opportunity, but not being based all the time in those universities, because the people who are in this program now are almost all of them they are in their 30s, almost close to their 40s. They all have families, so it's not possible for them really to go in a PhD program abroad for 3 or 4 years.
Okay, thank you for the information. Actually, that's to bring up that point, it's not a bad idea. We should get together and talk with Lisa Ung, our executive director. There is a program at A-STAR, very competitive, but it is for 1 or 2 years in Singapore, covered by A-STAR. So the 1 year would probably fit well with the people that can't leave for much longer. So I think it's an opportunity for us to talk, and perhaps at least 1 or 2 people could come over that way. Thank you.
But to give you an example, in the University of Science in Laos, this year they have 1 candidate. I mean, in the first year. Last year they had zero candidate. People don't go to university because they don't see any future. They don't even dare entering university because they know they won't find a job. So it's really an incredibly difficult situation in the country, and we have to build the things from scratch. I'm sure that Antoine, if he hears me, will probably not contradict me. It was not easy 20 years ago, 15 years ago. It's not easier nowadays, because they don't see any future in going into science. So we have to start really from scratch here. But your help is well noted, and I'm happy to take this discussion back another time. Thank you, Marco.
Exactly. Yeah. Let's talk over and see what we can do.
Thank you, Marco. We have a last question from Petya Dimitrov from the Stefan Angolaf Institute.
Hello, thank you very much for this nice talk. I know your struggles with the funding, because also we have a lot of struggles to have external funding and to really use different type of programs. So because I saw that you have a lot of experience with bats, I'm going to send you a link in the chat, because there is the Biodiversity Plus program in the European Union that is related with the keeping a global biodiversity. So maybe you should look in this program in order to find another way of funding. In general, the biodiversity was, the problem was that is funding, the funding is coming from the from the government. If they're into this agreement to follow the biodiversity program. So maybe you can look on that and you can see some opportunities, because it's something, it can be, you know, it can be some fresh, you can take a fresh air, even if you are involved in a small project with not so much money, but it will be a fresh air. So I'm going to send now in the chat. And there's also a climate adapt program in the European Union that might be helpful. Again, maybe you have to take time just to look on both. That is from me.
Thank you so much, Petya. I really appreciate it. And I think it's extremely interesting because it's extremely interesting to put in parallel the biodiversity of the bats with the biodiversity of the viruses or the parasites or the ectoparasite that we found in the bats. And we are lacking really of resources to look at this aspect. Thank you very much.
Yeah, and also, if you know, we have here in Bulgaria a lot of caves and actually a lot of different kind of bats, and we have some people working with bats, but actually they are not in our institutes. They are in different institute within the Bulgarian Academy of Sciences. And if you find some programs, I can try to reach some of them. If you want, I can connect with them.
Thank you very much.
Mm-hmm.
Thanks a lot, Petya. Okay.
I have sent it.
Yeah.
I have sent it the site, and also one place where also he can look. I'm not so sure that it will help, but still it's information sometimes.
And if you have, if you can take a moment, you can drop it in on pin link.
Yes. Okay.
Okay, thank you so much, Petya, and thanks again, Philippe, for your presentation. I mean, when we have a lot of questions, that means it's really interesting, and many people would like to collaborate, I guess, and help the development of IP Laos for the country and for the whole network. Thank you so much. It was the last seminar of the year. The next one will be on January 9 with an NGO called Global Health Advocates. It will be mostly about advocacy on global health. Thank you so much, everyone. And thanks again, Philippe. And see you soon. Bye-bye.
Bye.